Good morning, everyone. Welcome to our first session of this Medicare Education Expo, Breaking the Ice, Contacting Customer Service. My name is Ashley Decoto, and I'm a specialist with our Provider Outreach and Education team. On the call with me today is my friend and colleague, Karen Curtis, who you just heard from, and Karen's going to be helping out with the chat. We will have a recording of this session available in the Training Center on our website, and Karen will be adding a link for the Training Center to the chat. It will be available on our website for the next 60 to 90 days, barring any technical issues with the recording. And you can actually access this without having to access YouTube, as we do recognize that not everyone is able to access YouTube at work. The recording will also be available on our YouTube channel, as long as this information remains relevant and current. Also in our training center, you can find a copy of today's presentation. So if you haven't already grabbed that, it is still available for download if you'd like to have the presentation to follow along or maybe to take notes, though it's not required. We are taking questions through the chat today, which again, Karen will be monitoring. And I will check in with Karen at the end of the presentation, time permitting, for any unanswered questions in the chat. We received a number of great questions that were pre-submitted with registration, and I will be addressing the ones related to the topic of this session throughout the presentation. Here's our agenda for this session. Our goal for this one is to provide a summary of when and how to contact WPS Customer Service. I will talk about the role of customer service, the types of inquiries they can take, and inquiries that customer service is not able to answer. We did have a few questions asking to learn about Medicare billing. Our focus today is on contacting WPS Customer Service, and we're not covering billing in this session, but we do have a number of videos on our YouTube channel covering billing. So I've asked Karen to place links in the chat to our Billing FIS and Billing MCS playlist on YouTube. All right, last housekeeping slide before we get started. I want to do just another quick introduction. My name is Ashley Decoto, and I will be your facilitator today. I started working for Medicare in 2014, and I've spent most of the last 12 years as a provider outreach and education, or PO consultant for the DME MAC, where I previously provided education to DME suppliers on Medicare policy. Then I took on the new and exciting challenge of working on the WPS PO team back in January of last year, and I now primarily provide education on evaluation and management services. So let's get started by defining the role of customer service. First thing I want to talk about is the IVR. Now, if you're newer to Medicare, you might be asking, well, what is the IVR? CMS requires that all Medicare administrative contractors, or MACs, such as WPS, have an interactive voice response or an IVR system to help answer routine questions. So the IVR provides information, including but not limited to things like hours of operation, claim status, payment information, and other general information without needing to hold to speak to a customer service representative or a CSR. Now, when you call the WPS customer service number, the IVR is able to answer routine questions, such as claim status. It's there to give you immediate answers on more straightforward inquiries, so you don't have to wait to speak to a CSR. If a question can be answered by the IVR, CSRs must refer callers back to the IVR. The last thing I want to mention on the IVR is that it no longer includes eligibility information. To protect beneficiaries from Medicare fraud, CMS directed all MACs to disable beneficiary eligibility information from the IVR in early 2025. That direction was given in change request 13754, which I do have linked for you here on this slide. Eligibility may be checked by using our WPS Secure Net Access Portal or SNAP, or you may just hear it referred to as the portal. The portal is free to use, but does require you to register for use. If you're not already signed up to use the portal, we have information in the portal user manual on how to register. And I did ask Karen to place links in the chat for the user manual, including a link that will take you directly to the section on registering for initial access. So aside from the portal, to check eligibility, you may also, you can speak with your billing agency, clearinghouse, or software vendor about eligibility tools for Medicare that they have available. Or your organization may sign up directly for HETS, which is the HIPAA eligibility transaction system. And this is the same system that the portal and other tools use to pull eligibility information. Lastly, DDE is also an option for those who bill on a UBO4 or 837I electronic transactions. So now let's look at our Provider Contact Center, or PCC. The PCC handles provider telephone and written inquiries that cannot be answered by self-service technology, such as the IVR or the portal. Remember, this is a CMS requirement that CSRs are only able to answer inquiries that cannot be answered by the IVR. So if you ask a CSR for information that can be provided by the IVR, they are required to direct you back to the IVR. We do have an IVR operating guide, which can be really helpful in understanding the types of things that the IVR can provide to save you time when you call. It even provides some examples of the best way to phrase your question to get the information that you need. And I do have this linked in the resources section of this presentation. Next on our list here, the PCC may also complete telephone reopenings. We had a question which asked when to call versus fixing online. If this question is regarding completing a claim reopening, the preferred method is to use the portal to complete a clerical error reopening. If that function is unavailable on the portal, or maybe you're not yet registered for the portal, then a telephone reopening may be completed. The PCC also provides technical and non-technical assistance for the portal. And I'll talk more in a little bit about what exactly technical and non-technical portal assistance includes. All right, the next thing we want to share is that MACs are also required to use an inquiry triage process for telephone inquiries to help handle questions of various complexity. After self-service tools, your first level CSRs can answer a wide range of more basic questions that could not be answered by the IVR or the portal. Excuse me. Your first level CSRs handle questions that do not require substantial research and can be easily answered during the initial call. Your second level CSRs have more experience and expertise, and this allows them to answer more complex questions. This means that based on the complexity of your question, a first level CSR may refer the question to a second level CSR or even consult a second level CSR to help answer your question. Now, the most complex questions are handled by the Provider Relations Research Specialist, or PRRS. So these are questions that go beyond the expertise of first level and second level CSRs and typically will require more research. We did receive a pre-submitted question I want to cover here, which was, when I get a response back from customer service and I disagree, what is my next step? So in this situation, if you feel like the first level CSR was not able to answer your question, you may ask for your question to be escalated to the next level in the triage process. If you're not satisfied with the response after your question has been escalated through the triage process, please share that feedback with customer service. You do have the option to take a survey when contacting customer service, and your feedback will help the CSRs make any needed improvements. Also, if you do fill out the survey, be sure to provide contact information so that they may reach out to help provide a solution. We had another question asking what steps to take if customer service is unable to assist. And it really depends on what your question is, but generally the same thing would apply here. The question would be escalated through the triage process, and if you're not satisfied with the answer provided, please leave specific feedback in their survey. One more pre-submitted question asked, who at WPS answers regulatory or payment questions? This one's a little tricky to answer without knowing the question, but this triage process will definitely come into play. Depending on the complexity of your question, it may be answered by a first level CSR, or it may need to be escalated up through the triage process. All right, so let's talk about what information you'll need when you're calling. Here we have the basic minimum information that you'll want to have ready. And this includes your National Provider Identifier, or NPI, your Provider Transaction Access Number, or PTAN, and the last 5 digits of your tax ID. The IVR will require this information for all callers unless the call is regarding a general inquiry. Only fully authenticated callers who've provided this information may be transferred to a CSR, again, unless the call is regarding a general inquiry, such as maybe a general question regarding provider enrollment. Though keep in mind that because you don't have a PTAN yet in that scenario, you may have to tell the IVR when prompted for the PTAN that you don't have one. Now, if you're calling about a specific claim, you will need the information listed here in addition to what I had listed on the last slide. So you'll want to have the patient's name, their Medicare number, which is their Medicare Beneficiary Identifier, or MBI, the date of service for the claim, and the patient's date of birth. I also encourage you to have your remittance advice handy if you're calling about a claim for any additional information that might be helpful in order to answer your question, such as maybe the claim control number or the reason and remark codes listed on your claim. Here I've included the contact information for J5 and J8. Make sure that you're contacting the correct jurisdiction based on where you submitted your claim. J5 includes Iowa, Kansas, Missouri, and Nebraska, and J8 includes Indiana and Michigan. And this information is also available on our website on the Contact Us page, which I will be showing you after the next slide. So the PCC does have scheduled closures. They do close twice a month for training, which is usually on the second and fourth Friday of each month from 8:30 to 12:30 Central Time or 9:30 to 1:30 Eastern Time. They're also closed on most federal holidays plus the day after Thanksgiving and Christmas Eve. These closures are marked on the calendar on our website, and I'm going to show you where that is. So I've opened up our website, which is WPSGHA.com. To find the calendar for scheduled PCC closures, I'm going to click on Contact Us in this blue horizontal bar at the top of any page on our website. Now, if I scroll down just a little bit, here we can see this calendar for PCC closures. And I'm going to look at February actually by clicking this right arrow, since we've already passed the scheduled closure dates in January, which are no longer showing here for us. So you see here, it shows the holiday closures in gray, and then we have the customer service training closures in, let's call that purple. Also notice here in this note below the calendar, it provides those times for the training closures, and then it also notes that the IVR and the portal remain available during PCC closures. For the contact information that I showed on the previous slide, you could scroll back up to this drop-down box and select Customer Service and Interactive Voice Response, or IVR. And here we have the phone number and contact hours for a live agent. Now, one thing I want to point out here is this dark gray horizontal bar up top, and it says choose your jurisdiction to the left. Now, currently it shows that I'm on J5A, which I can tell because that is highlighted in this green color. You want to make sure that you have the correct one selected. And there's a reason behind this. If I'm in Indiana and I submit claims using a CMS 1500 paper claim form or 837P electronic transaction, I'm not in the right spot. Indiana is in jurisdiction 8, so I'll want to select J8 Part B. Then I could go back to the customer service IVR option here in the drop-down menu, and this will give me the correct phone number. We did have a question asking about who to contact at CMS. While our focus today is on contacting WPS customer service, I can tell you that, like WPS, CMS has a place on their website with contact information. And actually, let's take a quick look at that because I know this one's a little trickier to find. So if you were to go to the CMS website, which is cms.gov, and scroll all the way down to the bottom, you'll see contacts listed under tools. Now, once I click on contacts, I'm going to look in the drop-down box for select an organization type. And there's an option here for CMS RO, which is the CMS regional offices. And then I'll just scroll down and I'll click on Show Contacts. And this gives me a list of the CMS regional offices, each with a hyperlink to see contact details. So I'll go ahead and click on this one, the top one for Atlanta. And then you see here it does provide a phone number. All right, I'll head back to the presentation. So next, let's talk a little bit about the types of inquiries that customer service can take. So here are some things that you can ask the PCC. Remember, the key here is things that cannot be answered by self-service tools like the IVR or our secure net access portal. So let's look at these examples. First, you can ask the PCC for clarification on why a claim denied or rejected the way it did. Notice this does not say claim status or why did my claim deny? Because these are things that you can get from the IVR. But if you already know the status of your claim or know the denial reason, but don't understand why it denied that way, that's when you want to ask the PCC. So maybe you have your remittance advice in front of you and you have, let's say, reason code 4 for missing or invalid modifier, but you don't understand why it denied that way. You can ask the PCC for help with that. The next thing on our list is reopening a claim due to a minor error. So to give an example, maybe you miskeyed a modifier or your place of service, and you need to correct that modifier or place of service through a telephone reopening. This is something that the PCC can help you with. The last thing here on our list is some provider enrollment questions. For example, maybe you've begun the enrollment process and need some help with your application. There are some enrollment questions that the PCC would not be able to answer, not because the IVR can do it, but because there's a better point of contact, which is the CMS External User Services, or EUS. And I did include a link on one of our resource slides for a CMS page on who to call for provider enrollment questions. So this resource will let you know whether that particular topic can be handled by the MAC, like WPS, or if the question should be directed to the EUS help desk. We had a pre-submitted question which asked, why do some EDI questions go through customer service? Without knowing exactly the types of EDI questions you're calling with, I can't be sure why only some of them are handled by customer service. So let's say you call the IVR and you press 1 for EDI, but your question is asking why your claim denied. Well, they may refer you back to the IVR for that. So it will really depend on the type of question that you're asking. Next up, you are able to submit some questions to the PCC in the form of a written inquiry. These are for general inquiries only, and it's using a mail-in request form. And that particular form can also be used to request duplicate remittance advices. Keep in mind that this request form, which I'll show you, is not used for submitting appeals or claim reopenings. Rather, it's just for the general inquiries. So I am going to go out to the website again for a minute and show you where to find that form used for written inquiries. So we're back on our website, again, WPSGHA.com. And remember earlier, I clicked on this Contact Us up top, so we're already in the right section of the website. First, you want to make sure that you have the correct jurisdiction selected up top. Again, this does matter because the mailing address will be different on the form based on the jurisdiction that you've selected. So now I'm going to click on that drop-down arrow, and I'm going to select Customer Service Written Inquiry this time. So first, this tells us that responses can take up to 45 business days. And this also tells us not to use this form for redeterminations, which is your first level of appeal, and not to use for reopenings. I'm going to go ahead and click on the link now for Customer Service General Inquiry Request Form J8B. Now here, before I click download, we have this reminder to use this for requesting duplicate remittance advices or for general questions, and then again, the response time frame of 45 days. So if I go ahead and click on the green download button, this form opens up, and you'll complete all the fields and mail to the appropriate PO box based on your state. So if I scroll down here, notice on this form, we only have Indiana and Michigan. Well, that's because I have the J8 form open. If you're in Iowa, Kansas, Missouri, or Nebraska, you'll want to follow that same process, but with jurisdiction 5 selected. We had another pre-submitted question which asked if WPS utilizes an email where providers or their staff can submit questions. So on the Contact Us page again, there is this option to email us, and it will ask for your jurisdiction and the reason for your inquiry. If the inquiry is something that can be answered using this method, a form will pop up that you can submit directly through the browser. Now, if it's an inquiry that cannot be submitted this way, it will provide you with information on how to get your question answered. All right, I'm going to head back to the presentation. Before I move on to the next slide, we also have some information here on portal inquiries. So you are able to submit written inquiries using our Secure Net Access portal. If you use the portal to send a message to customer service, responses are also provided in up to 45 business days. We had a pre-submitted question asking if there's a way to contact customer service via messaging. The answer is yes, you can do this through the portal, but keep in mind that time frame of 45 business days. So if you're needing a quicker response, calling the IVR and talking with the CSR when appropriate might be a better option for you. All right, so when submitting a question through the portal, you will select what type of question you're asking. So you're able to submit both technical and non-technical portal questions. So what does this mean? Well, technical questions are those that pertain directly to the use or functionality of the portal. For these, you're having some kind of issue with using the portal. This could be where you need help adding or removing a service location, meaning you need to add or remove an NPI, or you need some help adding or removing a user's access. So maybe you have a new employee and you're trying to get them access, or for site navigation. So some function of the portal is not working the way you expect it to. For non-technical, these are issues that don't relate specifically to the functionality of the portal. So this could be questions on a policy, this could be claim submission questions, or even questions on claim payment or claim denials. For example, maybe you have conflicting eligibility information. Maybe the portal showed Medicare primary, but your claim denies for Medicare secondary. This is an inquiry you can submit as a non-technical inquiry through the portal. Keep in mind, though, that for this type of inquiry, it may be that your patient needs to update their records with either the Social Security Administration for things like a name or address update, or with the Benefits Coordination and Recovery Center, also known as the BCRC, if they've had an update to their primary insurance. We had a pre-submitted question kind of along those lines asking, when eligibility is not correct on the portal, what do we do? This would kind of depend on what was incorrect, but usually when this happens, the patient would need to update their records with either the Social Security Administration or the BCRC. Now, if this information has been updated and you're still not sure why the claim is denying, you may contact the PCC, but please keep in mind that they will not be able to update eligibility information. That is pulled directly from HETS, and it may take some time for the BCRC updates to reflect in HETS, depending on the complexity of the update that was made. If you're looking for more information on submitting these inquiries to customer service through the portal, Karen actually did an entire webinar on this back in September, and the recording from that webinar is on our YouTube channel. All right, now let's talk about the types of inquiries customer service cannot answer. Any guesses on what's at the top of our list? Did anyone guess inquiries that can be answered by self-service technology? If so, you are spot on. CMS requires that CSRs refer callers back to the IVR if they're calling with a question that can be answered by the IVR. So if you're asking why your claim denied, this is something that must be checked through self-service technology. So the IVR and the portal are both able to provide you with claim denial reasons. Next on our list is eligibility. CSRs are not permitted to provide eligibility information. So if your question is simply, is this patient eligible for Medicare? Or maybe you're asking who the primary payer is. You must use one of those sources I mentioned earlier. So that included our portal, a billing agency, clearinghouse, software vendor, or you can go directly through HETS, which again is the source for all eligibility information. Next, for claim status, I already touched on this one a bit, but the IVR and portal are both able to provide claim status information. So those questions, again, should not be directed to customer service. Next, for Medicare Advantage plans, we get a lot of questions on these. WPS processes claims for original or what's called fee-for-service Medicare. We are not able to speak to anything regarding Medicare Advantage plans. So if you have a question regarding coverage of a certain service or a claim denial by a Medicare Advantage plan, you must contact that plan. We do not have access to those claims, and each plan's coverage policy may vary some from original Medicare. Last on our list is coding questions. WPS is prohibited from providing coding advice. You must determine which code best represents the service provided. Customer service is not able to provide any type of guidance on which code to use. We did have a question that asked how to get customer service for questions that are not related to a specific claim. This is hard to answer without knowing exactly what type of question you're trying to ask customer service. But the key thing to keep in mind is that, again, if the question can be answered by self-service tools, customer service will not be able to answer those questions. So make sure that you're using the resources available, including the portal and the IVR. Now, if you're struggling to reach a CSR using the IVR, I understand that can be frustrating, and I encourage you to use the IVR operating guide, which I have linked in our next section. Before we move on to the resources, I have just a few more pre-submitted questions I'd like to address. First is, how is a facility supposed to know when a claim gets inactivated other than going to WPS? The answer is, in FIS, if you have access to DDE, you are able to use the claim summary inquiry to view the status of your claims. Inactive claims will have a status of I. Our last pre-submitted question said, how to ask the right questions when they see a DDE reject reason that's invalid and related to a systems issue. How do they communicate that? So usually system issues will be listed on our WPS GHA website. If you look for the message icon in the top right corner of our website, it'll be just to the right of the words contact us that I clicked on earlier. From there, if you were to scroll down, you'll see a list of either MCS or FIS claims processing alerts, depending on the jurisdiction that you have selected. If you were to click on the actual description of that issue, it's a hyperlink that will take you to a page that describes if any provider action is required. Now, if you still have questions after reading that, we would suggest calling and stating that you have a question about a system issue. All right, so I'm going to move into resources now. This slide has links to IVR resources. The link for the IVR operating guide, this one will take you to a page that will actually include a link to print the complete IVR operating guide. And if you click on that link, which will be at the top of the page, it will open up the full IVR operating guide. Now be mindful again of which jurisdiction you have selected up top, as that will change whether the Part A or Part B IVR operating guide will open, and they are a little bit different. This guide does include details on what types of information the IVR will provide, how to use the IVR, and what information you'll need. It also provides numeric prompts, this is my favorite part, to use on your telephone keypad rather than speaking to the IVR if that's your preference. Next here, we do have the IVR conversion tools, which help you convert entries needed for the IVR into numeric values. This one I think is a great one to save as a favorite, and you can have that open and ready to go when you're calling the IVR. The last link here is for IVR tips and tricks, which includes just that. Also has some information on the IVR menus, as well as some helpful hints for using the IVR. Here we have some customer service resources. The first customer service resource is the MAC Beneficiary and Provider Communications Manual, Chapter 6. And a lot of what I've covered today can be found in that manual. One great example of what you can find there is information on coding questions. Remember a few slides back when I mentioned how CSRs are not able to answer coding questions? Chapter 6 includes that direction, but also lists links to resources on where to find answers to coding questions. Next is the Contact Us page on our website, and we've been out there a few times today where we looked at the calendar with the PCC closure dates, as well as the form that's used for written inquiries. And then this is also where you'll find that email button. Lastly, on this slide, we have a link to the CMS resource that I mentioned earlier for who to call with provider enrollment questions. And this one is a great resource that lists many different topics that you may have enrollment related questions on, and then it indicates whether or not the MAC, such as WPS, can answer that type of question. Our last resource slide includes the portal user manual. The top link will take you to the main user manual page, which gives you the option to click links for each section in the manual or to download the full manual. And then I've listed 4 sections from the manual that I think you might find useful relating to some of the things that I've covered today. And this by no means is an all-inclusive list, but for registration, appeals, eligibility, and claim status, each of these links will take you to that section of the portal user manual. All right, we do have time for maybe 1 or 2 questions, so I'll check in with Karen. Karen, do we have any unanswered questions in the chat?
Hi, Ashley. Great job today. Right now, we do not have any questions in the chat.
All right, well, thank you so much. Thank you for being here to help out with the chat. So we will go ahead and move on with some reminders. If you do think of any additional questions, you have 7 days from today to submit those. And you'll send those to our education mailbox. And make sure to include the title of this session, Breaking the Ice, Contacting Customer Service. Include that in the subject line so that they make sure those emails come to me. Please keep in mind that I'm not able to access any claims history, so you will want to contact customer service for any claims related questions. We are also having a follow-up Q&A session for today's Medicare Education Expo. That's next Tuesday, and registration is still open. In a few minutes, you will receive an email to thank you for attending. And you don't want to delete this one without reading it. This email contains your certificate of achievement. It will have your name and contact hours if you need to turn that in for credit towards continuing education units. If you did not receive the email, a few things may have happened. First, you may want to check your spam or junk folder and make sure to add messenger@webex.com to your safe sender list so that any future messages will show up in your inbox. Also, if you joined us by phone only, you would not have received this email as there's not a way for us to capture your email systematically from the attendance record. But no need to worry though. If you joined by phone, you are able to email us with the phone number that you joined with to request your certificate of attendance. And Karen will be adding that email address to the chat. All right, last thing, please take a few minutes to complete the survey. Tell us what you liked, what we can do better, and this is an opportunity to suggest topics for future education. There are different options to take the survey. You can use the link in the chat, or when you exit today, you'll be prompted to go to an external site, and that external site is the CMS Qualtrics survey page. The prompt will look like the picture we have shown here with that little yellow triangle. And we included this image on the top right of this slide to make you aware that this is safe. It's not malware or anything like that. For those that might be listening through YouTube, you also have the same opportunity to provide feedback. You will have a survey card at the end of the presentation, and you can scroll to the end to find that link. All right, that concludes this session. On behalf of myself, Karen, and all of Provider Outreach, we thank you for taking the time to join us. We look forward to your survey feedback, and we hope to see you at the other events scheduled for today's Medicare Education Expo. Everyone stay warm and have a wonderful day. You may now disconnect.